The discussion forum held in Osogbo, Osun State capital, brought together top management personnel from the primary, secondary and tertiary health sector from the southwest geopolitical zone comprising Lagos, Ogun, Ondo, Oyo, Osun and Ekiti States. The conversations at the event, organized under the COVID-19 Transparency and Accountability Project CTAP, sponsored by Conrad Hilton Foundation and Skoll Foundation and executed by Budget Foundation, as well as Connected Development, centered basically around the political economy of healthcare delivery in Nigeria, governance architecture and failures, systemic challenges, interests and challenges of stakeholders, brain drain in the health sector, among others. It was a no-holds-barred conversation where participants poured their minds about the deplorable situation in the health sector emanating from prolonged systemic failures on the part of critical stakeholders from the primary healthcare system to the secondary facilities and down to the tertiary health sector. The participants identified low funding from government, corruption, lack of reward system, among other issues, as some of the challenges in the sector that have robbed the common man on the street the right to access quality healthcare delivery within the community.
Apart from paucity of funds, even availability of the human resources to carry out those things is equally dwindling.
When we come at this level to a round table to discuss the health sector, say it as it is. Say it as it is. Find solutions so that the next generation can be better. Maybe in our generation, we can effect some improvements, and then we can set a better, tomorrow for the next generation. If we go at this rate that we're going, everything is finished.
I'm more passionate than ambitious, and my passion is nobody should die. As much as possible, let's avoid avoidable deaths, and let everybody do whatever they can do. And that's why, honestly, my little bit. If the government is not working, I put the government aside. I go after philanthropists, I go after individuals, groups, alumni. That is me. They know me. I'm not keen if the budget is not going to work, because I know while I'm waiting and talking and shouting, some other politics are undergoing, and then some people are dying needlessly. And first, people who are ready to assist me to help save the ones I can do at that time and there.
If we don't build the skills of people at the grassroots, to even identify splitting corruption will be a problem. Even our general hospitals, for doctors, some of our doctors can even identify common clinic rupture.
Why should a hospital not have ambu bag? Why should a ward not have sphygmomanometer? Why are we looking for things? It's because we gradually accept that. I accept to go and borrow speak from the other ward, and gradually it becomes the norm. And that's how those things continue to degenerate.
The lead team from Budget Foundation, Mr. Iyanuoluwa Bolarinwa, said the conversation is geared towards getting the input of policymakers to set agenda for healthcare in Nigeria.
The only way we can have a way forward as towards the challenges that we have right now is to ensure that stakeholders are present to actually forge a way forward towards solving these problems. And this meeting has given us the opportunity to put all stakeholders from all the southwestern states into a single room and give them feedback that we get from community people, from the realities that are on ground, to share with them, and also now let them see what are the challenges people are facing, right? And also how can they resolve some of these challenges.
The CTAP engagement is being done in 9 African countries of Cameroon, Ghana, Kenya, Liberia, Malawi, Nigeria, Senegal, Sierra Leone, and Zimbabwe. Oluchi Amuda, OSBC News.